in Alabama, a doctor says he ain't treating nobody unvaccinated. That's it. Jason Valentine, a physician at Diagnostic Medical Center Infirmary Health in Mobile, Alabama, posted a photo on Facebook this week of him pointing to a sign taped to a door informing patients of his new policy starting October 1st. The sign says Dr. Valentine will no longer see patients that are not vaccinated against COVID-19. Valentine says he came to his decision because COVID is a miserable way to die, and he cannot watch them die like that. Alabama, of course, reported 4,465 new coronavirus cases on Wednesday. The state has recorded more than 645,000 cases since the start of the pandemic. The thing here is that he said, Adrian, he can't do it for people who have actually turned him down. He said, no, I'm sorry. If you're going to turn the vaccine down, I'm not going to treat you. There was one guy who was a video that went viral. I think it was a TikTok video. He did like 2 minutes, and he was mad as hell because his wife has a particular illness, and he said point blank, he said, since y'all believe in God so much, and since y'all say choice, he said, if you get sick, he said, play it out. Don't go to the hospital. He said, play it out. He said, if you don't, this is what he said. He said, if you don't believe the doctors and if you don't believe the scientists, play that thing out. Y'all go ahead and roll it.
Hey folks, how you doing? I just got a quick question about this whole COVID, not getting vaccinated and running to the fucking hospital once you get the virus fucking deal, because this shit is out of fucking control, all right? And I'm gonna give you a quick story on why I think it's out of fucking control. Last week I had to bring my wife into the hospital. She has stage 4 breast cancer. She was dealing with some symptoms, and I had to bring her in to get some fluid drained. She was having some pain, blah, blah, blah. She was in there for 2 days. On the 3rd day, she honestly should have stayed one more day. Maybe 2 more days, okay? But on the 3rd day, instead of draining her fluid and what they wanted to do, they told us that she had to be discharged because they had no room left in the hospital because of COVID. Here's my question. Why 99% of everybody that's in the hospital with COVID right now is unvaccinated, okay? If you really fucking believe that COVID's not real, and you really believe that's not a big deal, and you really believe that you don't need to get the vaccine, that is your fucking right, okay? I'm not gonna argue with you about that. What I am gonna argue with about is you running to the fucking hospital once you get the virus. If you don't trust the medical field to prevent you from getting it, why do you trust them to cure you from it? Why do you run to the fucking hospital? If you really believe that COVID's not a big deal and it's not this, that, the other, and you don't get the vaccine because of, stick to your fucking guns and keep your motherfucking ass at home. Stop running to the hospital, putting everybody else at fucking risk, and in turn, the collateral damages. People like my wife who actually need medical fucking help for a chronic fucking disease get kicked out of the hospital because your dumb ass is too stupid to go get a fucking vaccine shot. Keep your ass at home. If you really believe COVID's not a big deal, prove it. Stick to your fucking guns, keep your ass at home, and fucking deal with it.
Well, I think I'm gonna start with Reese because Reese, I think he went to the Reese school of viral videos. I think I heard at least 28 F-bombs, 3 or 4 MFs in there. And so you get to comment first.
Well, you know, I completely can empathize with where he's coming from. I don't know if people remember last year, the whole reason why we shut down as a country was because we don't have the capacity to deal with a surge in hospitalizations. I guess people forgot about the tents in the garages and the ship that had to come to New York and the mobile morgues that were established because of the amount of people that were dying. We don't have an unlimited amount of hospital capacity. In fact, as of yesterday, there were 5 states that have over 90% ICU capacity. Alabama, the state of that doctor who's refusing to treat people who are unvaccinated, has 99.3% ICU capacity. And that does that. So that means if you have cancer, if you have a heart attack, if you have a car accident, any kind of situation that requires medical attention, you're fighting with people in the hospital who refuse to take the vaccine, period. And it is a little bit unfair to those folks because there are people who have pre-existing conditions that make them immunocompromised so that they can't take the vaccine. And because of their immunocompromised position, they need more medical treatment that they cannot get. In some places, elective surgeries are being canceled again. And so this is a problem. This is creating a burden on our medical system. And that's why we have the concept, like I said earlier, of public health. It's not just a matter of personal choice, because people on a personal level cannot always be compelled to do the right thing for a society at large. So I completely empathize with his frustration. And one other thing I want to say too is I'm trying to not be completely cold-hearted about this, because I really do find it heartbreaking that we are seeing more and more stories about people who are unvaccinated that are dying. I just saw a story yesterday, a 49-year-old Black woman who's a teacher in Florida. She took her entire family to get vaccinated, but she did not get vaccinated herself, and now she's died of COVID. It's tragic. It's heartbreaking. Dr. Ebony Jade Hilton yesterday shared a statistic about how 120,000 children are now orphans because they've lost their parents to COVID. And we're at a position where this is preventable largely by taking the vaccine. And it is a choice to not take it. But that choice is impacting so many people who don't have a choice but to put their fate in the hands of people doing what's best for society. And so it's very scary. And the one other point I want to make about that teacher is that her family stated that one of the reasons why she didn't take, or the main reason she didn't take the vaccine, is because she heard information that she was uncomfortable with. And that goes back to the thing that I've been screaming about on this show for years now, is that disinformation is a deadly force in our communities. And the things like the Tuskegee experiment are being weaponized to detract us and deter us from taking the vaccine, even though Black people have a disproportionately higher hospitalization rate and mortality rate from the vaccine. And so we have to fight back against this disinformation that is really exacerbating this hesitancy that people might naturally have. And we have to try to save some of these lives, because people are being indoctrinated or fooled by this really insidious disinformation that is permeating our communities.
So, Adrian, is the doctor, is he right or is he wrong?
You know, I was reading the article, I saw a lot of folks citing, oh, you took a Hippocratic oath to do no harm. And it's like, well, yeah, but that didn't come with definitions, and it didn't come with with a series of clauses or corollaries. It says do no harm. And in his eyes, he's doing no harm. He's not allowing unvaccinated, very dangerous people, carriers of this disease, to come into contact and contaminate his work environment with his other patients, potentially some of which who can't literally, for health reasons, get vaccinated. So, no, I think if you're going to be in this environment of woo, 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 personal choice, oh, except if you're a doctor, like, or except if you're a woman who has to make a really serious decision with her own body regarding pregnancy, no, you can't pick and choose where your personal choice applies for your own benefit and for your own, self-interest. It's either personal choice or it isn't. So, I that piece really frustrates me, because the same people who say personal choice don't believe the same thing when it comes to women's bodies. Now, the doctor leveraging social media to make his point, I think is valid. I think it's important that the medical community starts fighting back against folks who refuse to accept the science, like the gentleman very colorfully said, who refuse to accept the science of vaccines, but then want to bang down the door for an ICU bed. I think the medical community fighting back is valid and important.
Greg, doctor, is he right or is he wrong? Fair, unfair?
I don't know if it's a question of fair or unfair, Roland, quite frankly. Certainly you can go down the road to Tuskegee, where they have a whole bioethics center, and debate the question of the ethics of a doctor saying he's not going to treat somebody that's sick. But I agree with you, Adrian. I think that, in the state of Alabama, of course, it's legal. But something Ben Watson said a minute ago is very important. This is political. It's two separate things going on that overlap. One is the science, and Dr. Hilton has talked about it, and you've been saying it since the beginning of this. We all knew this was coming. You've been talking about it nonstop. And so we know that we don't have cures in our arms with the vaccines. It just means we may be asymptomatic now if we get it, or we're not going to go to the hospital. As I'm sitting in class again last night, everybody's masked up, and I'm saying, we might have COVID in here right now. There's not the infrastructure to test everybody every day. And even if there were and we got it and you quarantined and went home, that's one thing. But with the variant, and we're starting to see breakthroughs now, even you might even it may be the Delta variant get you or the Lambda variant get you or so forth and so on. But that's a whole universe of conversation. The other conversation, and Watson brought it up, is a political conversation. The white nationalist party in this country has decided that its best shot to capture the federal government in 2022 and then 2024 is to embrace this weaponized COVID and use its followers as literal human shields to force their way back into public office. And so Biden's response today, telling Cardona, go and exert the federal apparatus through the Department of Education onto these states, that is a response that is partially political. They're trying to get to the elections of 22 and 24. That's what Abbott is doing. That's what DeSantis is doing in Texas and Florida. They are literally rallying this for political points. Now, the only wild card in this is that week by week wild card that we've been talking about, Adrian, you just said, because as this virus that doesn't recognize race or politics continues to make us sick and kill us, we are in a race literally against time, and what the white nationalists have calculated is they're willing to take that risk. So when Kay Ivey in Alabama says, well, what else can I do? I can't tell them to take it. I done told them to take it. No, you didn't tell them to take it early on, because you made a political calculation to put your white nationalist followers on the line, and now that they're dying, the thing that might break this up is those white people and those black people and those other people who come to their senses when somebody in their family gets sick or dies, worse if they are the carrier, vaccinated, unvaccinated, to kill somebody. But frankly, none of us know how this is going to turn out. There is no roadmap, but there are two separate things playing, and a lot of it's overlapping. There's the science and the medicine, and there's the politics. And we have to be very clear about that. And to Roland Martin and Filter's credit, you've been clear about it from day one, brother.
Absolutely.
Can I say one more thing?
I was going to say,
hold up. Adrian, then Reese, go.
Really quickly to your point, those are the folks who have that literally front door death experience, whose stories aren't being told on the news outlets, that these anti or vaccine hesitant folks are watching. Fox News isn't telling the story of this young couple who passed away. It's CNN, it's BBC, but that's not the platforms that these folks are watching. And I just, how do we compel Fox News to tell these stories? Like, good luck with that. I struggle to figure out how we send those messages.
Reese?
Yeah, so let me just say this. For all of the talk about the inequities in the healthcare system and the justifiable mistrust that Black people have in the healthcare system and in the government, the vaccine is the most race-neutral solution that is out there. It's free, it's readily available, and there is, I won't say no discrimination, because at the reality there are some ways that people might not have the ability to take the vaccine, but it is as neutral as it gets. So that's something that can prevent you from being hospitalized or even dying or having a severe case of it. Now, on the flip side, the treatment side, now, that's where all of the inequities come in, because you have somebody like Governor Greg Abbott, who has had a third booster shot, which is not available to the general public, and he had Regeneron. He had a monoclonal antibody. And I know somebody who has COVID, and they were vaccinated, so thank God they didn't have a severe case, but they were able to get Regeneron. But you know that I would say they had to jump through so many hoops. Now, if you think that as you, a regular schmegular Black person who's not insured and who can barely get into an ER, is going to get a very expensive treatment like Regeneron to save your life, you're delusional. So all of the paranoia and justifiable mistrust and distrust that you have in the government and the healthcare system, apply that to the treatment side, because that's where we are absolutely seeing the disparities in race and the disparities in the access that people have. And so if you have to throw your lot in with trusting one side or another, I would rather throw my lot in with the most neutral solution of something that has been administered 4.8 billion times around the world, and that is the vaccine. Not trying to hang my hat on getting access to Regeneron, which is something that has thousands of doses perhaps throughout the entire state in some states, and it's not even available everywhere. So that's just something to think about. What's neutral, the vaccine, or what's not neutral, the treatment.
Folks, back to our Roland Martin Unfiltered video in just one moment. Folks from Ceek.com, black-owned company founded by Mary Spio. Folks got a couple of products that's for our listeners and viewers. This is their VR headset where you can watch their content, 360-degree video, as well as virtual reality video. Just pop your phone right into here, close it up, and then you can see that VR content. They got different color VR headsets. This one is blue and white. Y'all Sigmas will love that one. Of course, I prefer the black and gold one. That's the one I have at the house. You also, of course, I have their headphones. Greg, you'll like these here. They got the black and gold headphones, but Greg, you might like these all gold ones right here. You might like these right here. 360-degree sound as well. You can use this for gaming. You can use this, of course, for music as well, watching movies, all of that good stuff. Use the promo code RMVIP21, RMVIP21, if you want to actually get one of these two products. And of course, when you purchase them, the resources portion of that comes back to us here at Roland Martin Unfiltered.